Good morning. Mutie free baby. I'm Dr. Ofori, and then the health and wellness show here, bro, from Chicago, Illinois. And then I think say you something about stomach ulcer. And GERD. Yenya Dr. Kunini do ha boy am etinya chechesa. Yare we mu na yati ase yi na say your questions be answer. You try say be answer. Facebook and YouTube nti wokɔ Facebook wobɔ Ako Radio wobɛte yɛn ka ɛwɔ hɔnom live and clear afei nso so yɛwɔ sɛdeɛ meka no YouTube ne yɛwɔ ayi nso so tune in nso so wokɔ tune in na wobɔ Ako Radio wobɛtumi ate yɛn ka yɛ audio feed no ɛkɔ ɛwɔ hɔnom na sɛdeɛ ɛbɛstart ne yɛde mpaebɔ ɛbɛsrɛ ɔtware ampɔn sɛ ɔbɛbɔ yɛn na program yi bɛkɔ yie na ɛbɛkɔ tɔten yen semre kwa ne bekwa koje nkrato kakra bi na se ba ye de Dr. Owusu Ansah ebeba so na wa train nipa oye na afin so ye de komo no ahyehye so nti men ko ba bia tam chukuni eba.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Ba eni ma medufi oye dwuma odukasi anopa biara me nua ba sori ahoɔden mu na ɔkwadwuma on complaining da sɛ ho ba bitutu no sanso na me bra o efitani o tu engine ni o pagya engine ya ka adwuma sɛ de sitie da bi biara no ho dendenden me ameyire o store no adi ni dwa me yire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanam papa ne mfia konkan ɔno so complaining da sɛ ho ba bia ne ya ɔsori anopa na no afanse kan no ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de bedampo na adias nanso men sorry da krokran ka se me hu ba bia me ya ni nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ni nyina ni kowa mesha kurani eyaduru a wonom a ebo ni padua no ema wo se pi usita me kanfo ama wo se won so no kowa mesha ni bi na beboa na aboa no obusua na yare da ho eya nunum bi na obedi adanse ubenya bi ato o ba bi eton no bia na opedodo otu nsu a fresh telephone number
0591 565 778 0509 876 891 and 0547 641 310. Say wo pe kwa mixture ato ewa America brochi memu call One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonana Feno Agenda, it was 0773-610-1112.
Kowa Mesha Abushia Amintas
FDA Asheshe Ejedi Nkratui Ajiatum se eye.
Yo yedamasi se masan any wohanum na yebeton komo iso and say Kowa Mesha any well remit in Athens United African Organization and also yasine mede and ne jumadi bremo. Yes, I'm requiring and say, and then Muha, Menamti, a Gomuha, Kwame, Untimi Mapiansa, and T. Mede, and then common opportunity, practical courses. And a GERD, and said, Yana Doctor Bio Hobber Boy, now watch it to him. Nti me nsɛm rekora no me Dr. Lubet Owusu Ansah ɛbɛba afidie so na waba bɛka kyerɛ no. Doctor na ho te sɛn? Pato bɛ o meet you ho amaya.
Yo, me that's it. Me ho yɛ nyame adom.
Wonderful. And say you who had check a crab nyame adom and say we look very fit na afin so. And then on topic ɛbɛka ho asɛm ne ade bi I think say you know what can ho asɛm mmerɛ bi atwam. Yes, Emre, ne baby saw nipa a woyɛ na dwuma bɛn na wodie na yɛtiefoɔ sɛ mo yɛ mo ho bia. Nipa kra woyɛ.
Yo, me that's it. Dodoɔ no afrɛ me Lovette Owusu Ansah. Me a pharmacist or Illinois has a my dwuma no sɛ me hwɛ other pharmacists, so me was staff a me hwɛ wɔn so a me a pharmacist ɛwɔ inpatient. And you know, my adwuma as a pharmacist for over about 22 years now. Dodoɔ no ano no me kunu me wɔ my for they walk about me no briefly.
Of school Ghana school been a team for person.
Yo, my school called the baby bebre.
Good.
Sabi a woman wa broche, but my son me call school kakra wa Ghana.
Okay.
No, sorry, Mr. Ate wa Nigeria. Papa na papa ye professor. Inti na to coin inti. Me call school one my primary years were in Nigeria. Secondary school, me call Ghana, me call Wesley Girls High School.
Okay.
And to me free when I'm sent back to America at the age of 17. Into my watch into me call University of Georgia because we are biochemistry and molecular biology first degree. And I'm a branch called pharmacy or Midwestern or Downers Grove, Illinois. Into
until I'm back over Chicago, I'm right.
Aye.
That makes sense.
Yeah.
Oh, great. Yo, yeah, that's to say, watch a tree. When you put away na escassi de bia, you show you today. In fact, nipa kwa se bia ma have here doctor what been in room kasa pa yi. Enti yen che ho kra na I think say e be start yen komodie no. Na yare we yare bia ye say o kan yare ya pa ba ko ye funyare. He say your funyare idea sometimes you know it's me very ne yaw no different level among kofu bebre especially more ulcers. Some of us you know maybe say we kakra bi wo ho sometimes I kind of ho in yam kra enti ye baby say peptic ulcer no kra na yare ben is it the same as say obi ye ma kana na bibi etisa stomach abscess ni ade na emo difference me anyway.
Yo, well, my disclaimer, I'm a pharmacist, I'm not a physician. So, me role no ye more of say after your diagnosis and crofona, yeah, more you know. I have a general understanding, and based on my understanding, no, mecheche mumukakra. And say Dr. BTA na or interject or add it to what I'm saying. They're more than welcome. Peptic ulcer no aye na ho te said de eye nkronkro bi nkitinkiti bi a ewo ye yefunu mu. Inti no they're like sores in the lining of your stomach. Na the most common symptom na de etumi ma ye hu se obi enya ulcer pa ye yefunu yare obeka se ne yem ye ne ya. Na ulcers no ye omu ahodo mienu. Abrofo be friend gastric ulcers and duodenal ulcers. Gastric no de ewo yefunu na nkasa no mu. Na duodenal ulcers no de ewo you kind of say intestines yensuno. Is that correct?
Aye.
Your small intestines affected the small portion, the lining of our small intestines. And you know, usually, you know, the most common cause of ulcer no bacteria. And you come to say the yana you feel so be a come to be so good. And no cry no one shot you are secreting acid, but as we go along, we are back on one. most of the time, no, a bacterial infection. Any long-term use of pain relievers. Simply put, pain relievers to say offer ibuprofen, naproxen. Done apotoka say different NSAIDs, non-steroidal anti-inflammatories, and even steroids. Sa and Rono affected it eats away the lining of the stomach and eventually will lead to ulcers.
Okay. Tina, just say also a crew in general, right?
A crew generally, a crew be a bacteria, adane a crew.
Okay. Now I mean you said it kind of pathophysiology and physiology. Now I am more of like ADD was a crotol skinner. And crew ato difference kakra and do. And see what kind of bacteria I could remove now. Yeah, usually in the basana the treatment no be different, right? Because I say cra emco, right?
Yes.
Okay.
Underlining to treat usually, let's talk about some of the symptoms, then we're going to treatment.
Right.
Into me can say you no yare. I'm say me share dan ya ulcer that. Into meaning if anyone can describe it, I'm say a burning stomach pain.
Right.
That is as we yefunu emu hwehwe wan kasa. And I say where did you mean? It's because you are bloated and you feel as if you have the feeling of fullness.
Right.
And in conform more also I'm tai kisu meaning say obi or that experience to they are belching or they're friend kiss you. Would the fatty foods to say we namely at the idea it to me affected. Obi so or because of heartburn.
Right.
Not just as an akuma hoshishino or the chest, we say a brother friend epigastric pain. I said it's not going down, it's rather coming back up. And then the feeling of nausea, which is also ufe. So those are the most common symptoms. But the stomach pain and then a cardinal symptom. I say obi was stomach ulcer.
Osha epigastric pain. Sometimes yana away with different area. Because yam so but him na I ask na
yeah.
And see what's not shrimu like epigastric in area bend and when I said about
That's a good question. This is where I need my diagnosis chance to.
It's a mania picture do or her.
Yeah.
But I say usually the epigastric or the mechanism airco or sternum.
And I think say one more quadrant, whether left or right quadrant, I believe. And I say sternum no in the middle of your chest.
Right.
And one will say one more map CPR, that's where you pump. It's right, like in between your breast, your friends say. That's correct. Into sending I watch an epigastric region, no. Right, it looks like it's right below your breast plate. And I'll be say shisho and kasa say yedimeko. From what I've known or what I have come to understand, I say meko kasa and shisho. Yeah.
Oh, okay. I think that if one more Facebook, remember the doctor described now. Share baby ribs no one and finfini open no but say a yarn no for epigastric pain. And I'll come back you say duodenal, right? Your gastric in your duodenal.
And your duodenal no dear or small intestines.
Okay.
I don't know if you have a picture to show, but small intestines, no. When you have ulceration and sores in your small intestines, and you're different from the gastric ulcers.
Right.
And those also can tend to bleed. And we who say obi wa nani stool no, there's bleeding in their stool.
Okay. Yeah, until I think say a chief for be who Facebook ya diagram be to one more. We young na wo onsa okwa bi a tube na wo dey ahye.
Right.
And I ultra we young ka kra bi a bi did go first no. That is what we do no na ura.
Right. So Ubeka say yeah, intestines na hona all the passage of stool takes place.
Right.
Into no. Ube who said to the beer ubi wa na moja e stool for that reason.
Now maybe say a do stage in I just I can see you because what started passing moja. Right, I just a corona brain and be a
right.
And nobody can comment on how much.
Well, usually, when that happens or when that occurs, that is probably through diagnosis through blood work.
Okay.
On blood work now, who baby hemoglobin levels are,
right.
And that will probably who say you are losing blood. Based on your symptoms, collaborate your symptoms with the blood work and come up with some kind of differential diagnosis to suspect, say, yeah, you do have a duodenal ulcer. Usually, there's really no drug to stop the bleeding, but to help to decrease and lessen that whole process from going on. Because, like I said, remember in Ruby Wahua, a Western, a cause to say your friend saying non-steroidals, anti-inflammatories, they are the ones that really are the culprits or cause the worsening of the symptoms. Usually, you will know a kettle and as a sort process, disease progression, so on.
Oh, good. So I think say pretty clear from what Dr. Ekano the stomach ulcer in a way, you crew and out right now. Sometimes from time to time, say, and we are the crown out between us that say, oh, pass it, Muja Ewos too. They're not just say, Muja is to be with Jana and one HSL was. I was also Dr. Hona, Dr. Eden, and making sure what diagnosis amount. Now, cancer number one symptom is epigastric pain, and I say sometimes it be feeling nausea near I just say, oh, shit, what cocoa, and I say, a bang. No fast, what is the pain be upon sometimes the Udi crana, a rate me up I can see. And yes, Miracrani, best sign, I share your signs and the symptoms make a crown. No, we will be said, a dear crying deba, what matters what the car can, and Ryan to say non steroidal anti-inflammatory. Aside from we also say, no, can be said, and but from collaborating in himself when he didn't intimidate stomach ulcer everyone.
Yes, late night eating so yeah, they are a culprit, and yeah, they are a bois with the with peptic ulcer. Medical bacteria. I'm friend in the scientific well, I'm friend a Helicobacter pylori. A bacteria be that lives in the layers of the tissues. Usually, under normal circumstances, and harmful, but when there's a disease progression, it may be harmful amount. And in addition to be our pain relievers, we will be out BB Caribbean alpha Motrin, Advil, naproxen, and your masana a problem. And I may bore other medications to say fast steroids obi or osteoporosis or fat or fat drobia to say Fosamax and actonella, all those can have an increase your chance of developing ulcers. Into
Okay. No, I mean, I think that's pretty much what can bacteria that's not bacteria we no cry no. Idea be I said you to say influence of COVID and that be it is spread from people to people. How does it spread?
I don't know how yeah. It's a very good question. I don't think that there's any clear explanation as to say if it spreads from people to people.
Right.
It could be through food, especially. Say ube to me I spread it halobacteria, but I don't think like from person to person transmission a very apparent. I honestly can't say that, but I'm thinking that it could be through, you can get it through food and water.
Okay. Yo, not just say I give a bit me. I will be say you tested say will be now when
right.
Also, maybe I do stage be when most of the time on better check not just say some bacteria.
Right. On better test too. They will always run the test to see if you are positive or negative.
Okay. All right. Yeah, until you know I know some bacteria we know M1. Now I be when you say some of the steroids and so on in a way.
Right.
Is there another kind of say physically I bet me cause ulcers like in terms of like say they kind of when it in term what did you
risk factors. Some of the risk factors I think will be eating spicy foods.
Okay.
We will be our pet spicy food as a so ye to say a kind of when didn't tell we will be our smoky alcohol. All those things increases your likelihood or your risks for developing stomach ulcers.
Right. Yeah, and I think so what very important part of it said you alcohol, erode a lot of things and cause more problems than benefits. Smoking is one of them. These are all risk factors, and I said maybe a man who are predisposed to stomach ulcers.
Right.
You know, in a way, if I kind of say, what me I prevent it, and I bet me, I make sure someone has a problem with it. Acidic food, Ubo again, I bet me I cause society. What me I call mukakra am I?
Acidic food, no, ediane bia, a bit, a mau acid.
Okay.
One of the ones I know of it, like tomatoes.
Okay.
And also, the body produces acids to help with the breakdown and help with digestion. Into your body itself also produces acid, and that can also worsen the disease or the progression just from what you are producing. Into na it coated the lining of the stomach to help prevent or lessen the acid production.
Right.
And a spicy food. I'm sorry. Spicy food, we know obviously will produce more acid than a regular foods. And those are things that as I see actually one.
Because very spicy.
Me personally, I like spicy food, so me but also me to be honest with you, and well, we have to also play it safe. We have the information at our fingertips now. They say near boy and buying.
Into tomatoes, I think the garlic,
garlic, onions, all those things are didn't know, especially
Yeah.
Because we use a lot of tomatoes, we use a lot of onions, a lot of garlic. So money now that baseline group of foods, acid production. The interesting thing with stomach ulcers, so obeying say I say one way, but it can become very serious if you don't take care of it. That's the issue, because you lose blood.
Right.
Until while say I feel faint. Maybe stomach pain and the main symptom. So we have to pay attention to our bodies and see what's going on. Best start lose weight. So they just have stomach ulcers. Right. So these are things that we need to pay attention to our bodies, because sometimes you don't know where the source of the problem is, and if it's something we could take care of it quickly, and you can come back to having your quality of life.
Right. Yo, as you said, watch it you am I Facebook me madam for power back ya obrago support as you said what you show in a face Mr. Wire share MIM all the way from Ghana. Also, Boslinga, and I want to be a mechanic. I was the diva herself, Dr. Libet, thanks for coming. And after the OB Ghana series, OB, and I said, also what you need and I would think. And I also advise that, hey, acid system. I think that okay, acid Nayana go for you, show because this acid, the idea for some connotation, you're going to say. Acid
there, baby. I said it depends on the category or the type of acid we are talking about.
Right.
Our bodies also produce acid.
Acid, right?
Exactly. And the thing is, we live in if we know chemistry, acid base, and neutral environment. Those are all things that determine how we survive. Actually, our survival is based on sometimes whether we have to be in an acidic, or our bodies have to be in an acidic environment versus a basic environment. But that's a topic for another day. But just to make a long story short, we do produce acids in our body, and that's what helps break down our food now, digestion. So overproduction of acid, overly producing it, and a problem.
Right. And of course, it's our problem. That's the watch it come up. But some ever next question, what fact particular someone. Was it your girl and so I give you a hand for food. I say a bushy. Now, Obidia, I did what Nasia, Sana, what me, and what and the difference between the woman office and also the neighbor.
They all actually are tied into the same family of diseases, but the problem with GERD, and say, one say we are supposed to the way I'm trying to explain it in the simplest form possible. Send your body AC Emma Ebianeno flow through the you can understand the track, for lack of a better word, the eating track, as I say, a coffin. As I say, a corner, you go through digestion, and then if what needs to be passed out needs to pass out.
Right.
But unfortunately, for some people, that process is delayed and is slowed down, or even sometimes due to some kind of process abnormality. Ntina eduane no nyina eye den out. It's not come out, but it comes back up through your chest. Into obi wo a obahu se odidi na okoda na ase the chest na ehhehye no biom. Inti no it boils down to the production of acid and not being able to to push everything down its normal track as it's supposed to go. To be said to the beer na BBI back up. It has to do with some pressures in our stomach. It causes our problem. It's our abnormal stomach pressures. Into, like I said, I'm a doctor, but I'm trying to give you the simplest form and how I understand it at a base level.
Right. And one, I think so. What you come on me at here, say differences in pressures. I kind of say.
Right.
Conditional. It a key. So the idea, obviously, it was sphincters view over a bois closely baby and any go, any baby a digesting, Said away again and some in free form and cosway. At the be a one direction.
Right. So yeah, a tube. I say tube na no fem.
Right.
It is a tube no so a drew baby as I say a called digestion, a drew baby as I say bisusuka. One said there's a pressure that pushes all of that down. So if that pressure is abnormal now, one said bibia best start I say a samba back. Into that backwash is what irritates the lining of your esophagus, I think.
Right. That's true. Now, so the OB can you see acid says and as we are massive decent barber sweet. And I know to me, and cause it minimum I want
there would be irritation. So a idea like we were saying, acid there should naturally. So wow, if you've worked in the lab before and you've seen what an acid looks like, utumu say a idea irritating, irritant. And this is why we have this problem, because anything that irritating there, right. And just imagine we are dealing with the insides of our bodies. We don't even have the skin protection. Even it's just like wushi acid ego obihun. Initially, so it's the same concept going on, but it's going on inside your body because you have overproduction of this acid.
Wow, at least animal way now intimate cause major issues because I guess Yanko Ponch in such a way said there's a mechanism of building a protection from that. But my whole question be from Obi, not Obi, so I say stomach grouching a symptom of ulcers. I don't know what you know what I'm saying. I think go for your boom crew, right?
It's hard to say if grouching, if you mean noise making.
Mm-hmm.
I don't know that grouching is a symptom of stomach ulcer per se. Made me feel say a pain, I will be feeling
right.
That's burning, irritating pain, and then it probably is the cardinal sign say you have an ulcer.
Right.
Noisy tummy could be anything. It could be you going through digestive issues. It could be you having gas. It could be a whole lot of things.
Right.
But for one, Becca said we were also there now on market test. H. pylori test, no any sign really. It's just a stomach ulcer.
Okay, that makes sense. And the Obina say Otiana, I think say usually gases, right? Which produces that noise making that movement of your intestinal tract and OT. Signs and symptoms of ulcers now, of course, pain is one of them. Indigestion one of them. One more Facebook, you will see all the signs and symptoms. Bloating so can hold. It be more bloating.
Yes.
I've seen a lot. And a heart pains. To say when your heart pains. I could see more that I said on so great information. And tonight I heard GERD and ulcers now. They're almostly causes pain. Now you better move your treatment so now so you pass here so sayari we no man we are funny ya obako doctor ho na se wan kasa betimi aso anu wo fie kakra H. pylori abo anu obo dewru kakra yi five so na fa so e treat it bacteria
with Peptic ulcers, no, usually, no, the treatment, no, a combination of enro on the bema. Of course, yeah, both H. pylori, bacteria, and you know, that they will give you antibiotics. On bema antibiotics to take. Todebia, yeah, the no say todebia cry. One the I think it's anti-gas medication.
Okay.
Now, we have what we call proton pump inhibitors. And no, Nidino, so what cost to a bit to say Prilosec. Meaning say, we be who over the counter. Rebecca say, fair in combination. First, one person almost saw H. pylori acid. So they want to treat the infection. That's the most important thing to do, is to treat the infection.
Right.
And then the other symptoms that follow, no, they can also help curtail it with these other medications. Proton pump inhibitors, usually what they do is they help stop the production of the acid. And also, say less acidic environment in your stomach. Yeah. And with that, so it has its other issues, because you will also have other bacteria growing, because the acid there is also to prevent other bacteria from growing. And you have to kind of be careful. And dry your person will find over the long term.
Oh, okay.
Yeah.
But if I say antibiotic now, one for H. pylori now, can sort of a bit me come more for what in here. Now, for Francis, also for a
Pacho say,
a bit me a more body in here.
Yeah, a bit to me, and you have to be careful. It's usually antibiotic in your idea, a man a long term. You probably give it for 14-day treatment of antibiotics, and then ABI, they will add a proton pump inhibitor like Prilosec. Your friend, my name say it's over the counter now as a omeprazole. Ibisa near the amount. And now back my friend said pantoprazole kind of brand. So those are the major ones they will give you. Those are the most common. First near or antacids actually. I know your friend H2 antagonist. So obi wa to me tolerate one or the other. You can flip-flop. You don't usually give both. Until BB to say ranitidine, I think somewhere year free over the counter. I don't think they've removed it from market, I believe. But Pepsid or famotidine, a very common one, and also over the counter. You can take to help with the decrease of the stomach acid.
I think that's one of the treatments for peptic ulcer. And even I'm before we now no antacid.
Yes.
One of the bread is so be bread because we odidibia na the negotiation and answer the yemi na wa push antacid bibia no. So no ho ana.
Say you are compromising the year of the environment. To say they are kind, no. Per se environment, no, so they're too compromising. So we are careful with how you take medication. So, it won't say a idea. You can take it as needed. Actually, what you mentioned, no, you can take it as needed. It'll be unstoppable. But we just want to know, say, you have to be careful, because and also side effects, and we say to me cause constipation and diarrhea. Either it could go either way, which is kind of strange. So I know depending on ingredients now what antacid no.
That's it. And I think that a okay say obi over now or yari na obe koso afa antacid to be
The main thing you want to do is you want to seek help from your doctor.
Right.
Seek medical advice. Now they will do the necessary tests possible, and then they will determine what medication is best for you.
Right. Okay. Aside from H. pylori now, bacteria now, and so on food in terms of like preventative measures. Be abra when you are and near my benny so yeah, said a way enquire to say when you stew in your blood, actually your blood in your stew, I should say.
Yeah. So near your kind of risk factors. No, you want to avoid smoking, drinking, and spicy food. You can spicy food and unnecessary stress. Something we don't mention. Stress and so to make ulcers. And these are things we want to work on. So we will be a smoker, then you want to reconsider smoking or drinking also. Sanya, your health is your wealth. I can't say that. You want to be able to have that control over your life, then you need to in your when what idea is see spicy food. So we will be able to me and yeah, there are other alternatives for spices that are not harmful, and those are things we need to explore and see where what we can use as substitute to normal spicy choice of spices.
Right.
Yeah. And like I said, stress, we want to avoid stress as much as possible. And one major, I know for me personally, one of the major ways to reduce stress is sleep. Yeah. You want to get enough sleep, which is tied to how you diet. You have to be careful. So, yes, sir.
I don't think I did any problem because maybe it was a problem.
Think about it. And you are laying down and your body is still producing acid. So if you think about that whole concept now, it's a melody of things going on in your stomach at that time, because if you eat at night, the propensity for you to lay down is high versus if you eat during the daytime if you're moving. I mean, it's not in every case, but in most cases. That's what causes all the backup of your acid and can cause GERD and hence ulcer.
Okay. And that make me, because usually it's only the area there, and sometimes you sleep. Is it okay at that time? Is it a particular say be an moment now producing more acid than
it could, you know what? When at night really is when your body produces a lot of things.
Okay.
And thank you for mentioning, because I know crime me refi. And I do at time old and time now our body so air producing the chemicals, air producing nyoma here, so that we be sorry no panel. Now whatever it needs for fuel or it needs for it to drive itself, it's already being produced. That possibly could be another reason why you shouldn't even eat that late, because then you tend to overproduce more than what is needed. And like I said, if there's anyone here who is a physician or a nurse, they can chime in and help out. But I believe that that's also a reason.
And I think say no, they are correct. So that even cholesterol crown, that's the time.
Right.
Body they produce the most. So you have more parasympathetic drive than sympathetic. We are anatomy and physiology.
Yeah.
Switches ideas now, then you end up having more acid production.
Right.
Until the day idea will bigger impact stomach ulcers, because any idea you good you can say now your phone you have been quite and on your beer war Susan Sophobia and some of it always a question now. Also will be about say drinking what, doctor?
Alcohol.
Please don't say alcohol.
Alcohol.
Was it won't be
To me, you will have to make that decision for yourself. So, to me, there's no way around it. We don't cut corners when it comes to our health.
Right.
We have to address it. So, until we will be our ulcers now, we know Sadia. Meaning the Mecca says so jai. Because, like I said, also Arabia a very funny area. Obeka say when you're in Naho, but you are losing blood, you get faint, you know. It to me lead to other things. So you really have to weigh the risk versus benefit for you. What is more important for you?
I think say I can't moja ho asem no. And you are saying we be see who say I be emphasis of okuja na ya whether who say e bia I do moja woman. I say enye moja koko, right?
Yeah, friend said because I has a digested blood into fat if it's coming through your stool, your friend a dark tarry stool.
Right.
So they been so some people almost vomit it. And no dear and yet digested blood. So and so by red who say obvious say there's blood in the vomit.
Right.
So that's the difference.
Yeah. And see, as a obi asmo kan about me we dey make a film about alcohol in a. We say you will be your friend e budidi. Say krofo bebre na no apetesa say no modidi. Or reverse na na because we be so ntimi nyai. You know.
And that's a good question. Maybe they met me, I can say you have to limit your alcohol intake. The wound now, you have to limit it.
Right.
Because expectation, even worse than the regular alcohol, you will we have to learn to limit it. And they're very erosive to our bodies. And we know that. In him say, local alcohol, no. It has no grade if feast of famine in tea. You have to learn to limit your alcohol intake. I don't believe in cutting corners. In
correct. In the MI say NSA and I'm free doctor and channel. And see, I think Kumuya na you do stage beer. You pursue a wrap up the show now. My doctor echo because she has other commitments. And then Kasa from stomach ulcers and GERD. And no the potokasa about the battery man to say Yamukika and I say Yamuyare. You say and never be been by Johnny Eddie Crat me the bar. And a Timia Estudia who say conditioning no cry and no society courses are proven way. Now I work it to you and I said no could be a friend H. Palory so to me course ulcers ni baby not to say kuna about yemuno no could be a cotinamua save you dunya into no treatment and I say woman antibiotics na etimi ekum sa H. Palory. After so no yesan hwe baby I say obetimi afa antacids in same crofo we use emra omonya indigestion. And Dr. Sanchez, you say, great, Arabia. Sometimes I have Boshishia, so what did you read now? Boshishio because with digestion, sense a beco form, yeah, above ice as for chin, above a bastro. Now I will go minimum, just I start to say, what a shishia, a Boshishia, your chest. Yes, I can say, so who said, Nima winning to cause was symptoms here, boss, we won't have bloating, we young, especially on our cocoa, I see her notice a pain do over that agent far point if we can epigastric pain. I was aware then doctor. Now you're more treatment, and doctor Abu Bosu will say with me antibiotics. If you want to be a proton pump inhibitors, omeprazole account one as a private account. And then yes, yeah, and never be brave. Now your questions so be brave from one Facebook and you be a what question be for Facebook. Na any sakomo na yeka Facebook once and then Nana Williams said say what you in and I would see him. We'll be say why is it that Ghanaian doctors don't recommend CBD and not THC for ulcer patients? Question where you are because I'm a big proponent of CBD, not the THC part, but CBD will a lot of effect when it comes to gastric acid production control. And I face so sound too old before say onya alcohol na ono THC and then say you show you and shut that and recommending we say use THC. But again, if you need it, then actually prescribe THC and they prescribe CBD. Dr. Betty at the amount. And in a way, in the Williams CBD idea oil. Some of our people in especially US and Poma legalizing them. Some people use it to control ulcer conditions. And to doctor, let's stand the back now. You wrap up the show in a way, you perceive utu for about the name maybe over here. Ever prevent you almost stomach ulcer. Now, you be aware when you what are some of the things that they have to do to solve the problem?
Okay, that's it. Brony Fred BB, when you know better, you do better. Into ye kakra ye can say, as I say, a share who ye. We live very busy lives, and especially your woman on your lives no are so busy and so crazy. So sometimes we lose sight of what's going on. The we work some of the worst shifts known to man. We do some of the bottom of the barrel jobs. And we really need to take good care of ourselves. And like we have said, with GERD, and stomach ulcers, you really have to pay attention to your body. Maybe we fan say, oh, but and yes, ABI stomach ulcers. It's something I said when doctor but some of the things I able to prevent it from getting that far. No, you can't smoking, you can't drinking. Aduane a yɛdi ɛsɛ yɛhwehwɛ mu sɛ woyɛ obi a wodidi na woyɛ meyɛ ɔyɛ a ɛsɛ sɛ woyɛ careful. You watch what types of food that cause that that process. You watch it. One ɛsɛ woyɛ watchful. Yeah, na yɛyɛ guardian of our foods. You have to be a label reader. Obi a odi tomatoes a ɛkɔse even asthmatic attack. Actually, GERD, come to think about it, could lead to asthma.
Oh,
we haven't even there's a correlation. We didn't even talk about that.
Oh wow.
Yes, GERD can. Ulcers, pretty much, except for GERD, they don't use antibiotics because it's not the etiology is not bacteria. Yeah, indeed. But we have to be careful because you have respiratory issues masked with GERD. So as I said, there's a correlation. Obi was starting your GERD symptoms, but now we're starting your asthmatic attack. As I say, you decrease your stress levels. We find ways to help us deal with stress or cope with stress. Sleep is one of them. Exercising is another. Taking a break when you actually need to do that. With COVID we hear all about self-care, and self-care you can't say anything. It's simply taking care of yourself.
Right.
Mental health. Say we are stressed out. It takes a toll on the body itself.
Right.
The two are not mutually exclusive. They all work in sync. Right. The body and the mind, your emotions, everything works in sync. When you're emotionally healthy, now we are stressed out. It affects your body. If you're in a situation where we are stressed out, you have to remove that situation, or remove yourself from that situation, so that you can bring your body back into itself, into equilibrium, because the body always wants to do that. And then the body is trying to just fight off to come back to normal. Right.
I think some question be amount. I don't know so answer now, but coffee, right? Coffee idea about America and other countries. I think some review baby said, it can actually cause stomach ulcers.
It can. It can.
true?
Yes. Caffeine can irritate and propagate stomach ulcers. That's absolutely correct. Yeah.
Yeah. And see, one, coffee. If you more, maybe say me when I'm in your coffee back I mean, me non pet menya this upset. So then the question becomes, say, answer Rebecca say, oh, I did menya stomach ulcer. I say a person and maybe for some time, and I say, maybe once a while, be not we it's okay. Is it a normal thing?
Oh, my patcho bisa question will be on why.
Like, sometimes obi to me any or to me not all these symptoms yeah boss we. I try be about 1 or 2 days never. Now and also this selling food be an edeba. I don't know I saw cool doctor now say or no antibiotic antacid be near the or you okay.
It depends on one who say you are really the author of your body. Me fan say I will have to gauge. The idea me first say course 1, 2, 3 days. Yeah, I will call my doctor. Yeah, I yelled that until feel say oh mefa antacid. Antacid is very general and broad based. Until sometimes we'll far it works. Sometimes we'll far it won't work. Until you have to decide for yourself. So I cost it be at 2 days. I mean, any resolution in the symptoms. And before I will be Drobiano, you should be contacting some kind of professional, whether it's a pharmacist, doctor, nurse, whoever in your circle, you can reach quickly, When you are the next best thing is to get a hold of your doctor and let them determine what's going on with your body.
Right. Yo, I think that's a very good way to put it, because and maybe yeah, and I have tried say bit me solving your problems. I almost will be the comment to be about Hanuma. It's speaking to the fact that you still have our medicines, exercise to treat a lot of diseases. Practical say one of those things that with me you should herbs, and I mean that's pretty much what this person is asking.
I think it's a good, we need to explore the use of herbs. We don't do it well enough. I think Africans need to jump on that bandwagon. That's an opportunity because meaning say Ghana say herbal clinics are really there. But the question is, how are we standardizing the medications we are giving?
Right.
That is, I don't have a problem with alternative medicine. I always say this, but we need to learn to standardize. We need to go back, take those back to our labs and analyze them, do what we need to do to promote them. The Chinese are doing it. I don't see why we can't do it. But it's all in the kind of leadership we have. So I think we can explore. The answer to the question is we can explore using herbs. Exercise is always good for everything. Exercise is an adaptogen for life. And anybody who knows me knows that I'm a proponent of exercise. So yes, we need to exercise more and also explore the use of herbs. Me idea, as I say, I think we've talked about this before. So say not just talk about it.
Right. We just act on it. Yo, I think that and the direct premiere picture, right? And I think at this point in the show you about every year. Dr. Esther Ojayan, Jan Manako at 11:13. Mom tune in the Munina, Mom with the commenting by so Damasi. And so next week in the West End, the show for Abraham on your way on Akko Radio Health and Wellness Show. And say every time I can say show you the doctors about a moment room and they assume they may be about pepsi course. Now next week in someone Musan tuning in if ever have I know say next week Kwame Beba Betana Jim na maternity one. Into yen same be never commercial break now you cover you end the show. That's a bit brave.
Wow! Me pa na fi ma file me tax including dia kwa mami. Na ene se afe no kwa wiye me tax file na beye me asompidie ene nkwada na. Nanso with Akunim and Associates say die menyo butantim e me tax issues ahodi nyina mu. Onua wow anything e was file or tax with smile. IRS for editable atoso. Womu hunehuna, womu tata, wo file or taxa. Dapia da uboka, usika unya ekitu ebi. Make no mistake. Fahobo Akunim and Associates. With Akunim and Associates, what tax filing ebedana S gracia ubeji boom, no problem with IRS. Yes, or your experts were individual and business income tax with fast and efficient services, rapid refund, maximum refund, audit support, electronic filing of both federal and state filing, and NSM, Akunim and Associates. State BIA Iowa America, Kroponimono, Mepacho, Womu, Ewo, GDA, Anamon, Quine, Pasua, Wombetime, True, Akoshem, Ewo, tax filing. Ain't baby Bia will be a Utimi, any Akunim and Associates, Etokese. Najuma Dia, Obonti, Akunim and Associates, a deal Bia the friends Ura gender, not just say, Wakudarimu, Abeng, Ewo, tax filing. Fawobedan Womo, Shishawana Chi, Quine, Ewo offices, Audua, Edisway. First location, 684 West Boughton Road, Suite 201. Bolingbrook, Illinois. Zip code no is 60443. Second location is 7810 Springside Drive, Plainfield, Illinois. Zip code no is 60586. Fre Openi Kwanchaf Wanum Ewo. Telephone number 773-6101-112. Number NBM is 773-6101-112. One fax number is 708-247-3454. I feel bit my mailing no akunim.info@gmail.com. Akunim and Associates, yes, Nukrenie, open kunim die ewo tax mudia. This is what took us with Akunim and Associates. ANG Nkwa.
Minia ba eni ma medufi oyeduma odukasi anopa biara minia ba sori ahoɔden mu na ɔkwadwuma on complaining da sɛ ho ba bitutu no sanso na mebra o efitani o tu engine na o pagya engine be ka adwuma sɛ de sitie da bi biara no ho dendenden mi ameyire o store no adi ni dwa meyire ensori anopa enka sɛ na nia ha anase ne ho ye ne mreda sanem papa ne mfia konkan ɔno nso complaining da sɛ de ho ba bia ne ya ɔsori anopa na no afanse kan na ɔkonefu me akrobeto madwuma meyɛ me kan news na me acte na me kɔbeba da biara no ebra me de beda mpona adias nanso men sorry da krokran ka se me hu ba bia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a wonomu a ebo nipadua no ema wo si pi wo sita me kanfo ama wo se won so nonom kowa mesani bi na ba boa na aboa no obusua na yareda ho eya nunum bi na obedia danse obenya bi ato o ba bi eton no bia na opedodo otu nsu a fe telephone number
0591 565 778 0509 876 891 and 0547 641 310. Say wo pe kwa mixture ato ewa America brochi memu called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Feno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadi nkratuo yi agiatum se eye.
Jo yedamase se mugusu na mutie na me won kratuo kakra bi ampese me de ma etiefo mahu se me wofa Patrick say ohwe from Spain but as we said ohwe last in kratuo ampese me de ma etiefo ne ye one more Chicago hanum no I think next week you Ghana Community Health Clinic. Ghana Community Health Clinic here clinic bia yaka abum na ye this song for one more Chicago, especially Chicago City and then suburbs ni na say we Ghana ni na say we will be a here apomudin check up obetimi aba Ghana Community Health Clinic. You Dr. Prince Hodogwe ne Dr. Jamila Okoy Dr. Eunice Cromwell, me amity her so me ka ho, and Dr. Habiba and so ka ho. Sa team ni ya cast ye ho abom na ya take clinic bia. Free. Open say over na you check your blood or blood sugar level or blood pressure. Never be brave or quite betting amount your doctor for Macadarium. In addition, your son will volunteers be mobile every month beyond your organized clinic once every month. Now this particular month on the Saturday 11th, June 11th, you better what the Church of Pentecost Romeoville. Address near 302 Els Butler Road, Romeoville, Illinois 60446. Buy a platform so wiki money the address never to one na so opposite Oba clinic bia abeboa. Enti the oho no among what Chicago no Mr. Mo am take advantage of this. Na mo kanche mo maka say there will be a Ghana community health clinic visit. Romeoville na mo mra mo numbers. Na mo mehwehwe mapomuden in show way show be encourage for and as one would see and take your health serious. Inti I offer free community health clinic, insurance, really Obama nurses, doctors, special and pharmacists, and into Mr. Wamun take advantage of this. Inti na the EDBC next week, if sign about you na yaba heading about what you mediation. Want to make a I better Yankopon say what can you show you about and I really talking into the next week.
Just one more pic, JJ, please.
Oh, Mama, really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.